So when you're in a busy clinic or not entirely familiar with the subject matter, it can be difficult to talk to women about clinical research. But we know it makes a huge difference to women if the midwife or the doctor caring for them understands the research, supports it and encourages them to take part. So we thought it might be helpful just to give you a brief demo on the sort of information you should include when you're first introducing the C STEROID trial. So now that we've confirmed that your baby's going to be born by a planned caesarean section, is it okay if I just take a minute or so just to tell you about the C STEROID project? This is a research trial that our hospital is supporting. So as I've mentioned to you, there are some risks for mum and baby being born by a caesarean section before labour. And those risks for mum, things like infection, we know that there's some things we can do to help reduce those risks. So for example, we'll give you a shot of antibiotics to help reduce the risk of infection. But yet what we don't know is what we can do to keep babies safe. And what we know is babies born by a caesarean section before the onset of labour at a small but increased risk of having some short-term breathing problems. And this may mean that baby needs to go and spend some time in NICU soon after birth. But what we also know is that if we give steroid injections to mums before a premature birth, then that's really helpful at reducing those breathing problems. So now what we want to do is to see whether or not these steroids have the same effect if we give them at a slightly later gestational age prior to mums having a caesarean section. So the trial, the C STEROID trial, is going to be run all around New Zealand, and we're inviting women who are having a birth after 35 weeks by caesarean section to consider participating. And if you agreed to be part of the trial, you would meet up with the research team, they'd ask some questions about yourself, you'd sign a consent form, and then you would be randomly assigned by a computer-generated system either to receive the steroid injection or a placebo injection, like a dummy injection. They both look exactly the same. You don't know which one you get, and we won't know which one you get until the end of the trial. And that injection gets given twice, so one day apart in the week before your caesarean section. Once your caesarean section day comes around, the medical team will proceed with that as normal. But one of the things to be aware of, it is possible that these injections may have an effect on babies' blood sugar levels. So for all babies that are in the trial, we'll be performing blood sugar tests in the first 12 hours of life. Those tests are done by experienced midwives and nurses, and it's just with a small heel prick for the baby. That shouldn't cause the baby any harm. And if your baby got a low blood sugar level, we would treat it in exactly the same way as we treat any other low blood sugars for babies. And once baby's been born, you've had your caesarean section, we'll collect the rest of the information from yours and baby's medical records. And the only other thing is you'll receive an email with a questionnaire about 6 weeks after baby's born to see how you're both going. And then really at the end of this trial, we will know for sure whether or not using steroids prior to a caesarean section safely reduce the risk of babies having breathing problems. So it would be absolutely fantastic if you're willing just to think about it. I've got an information sheet for you here which summarises a little bit what we've talked about. It's also got phone numbers and email addresses and a website. So if you'd like to have a look at that, please do. And once your caesarean section date is booked, a member of the research team will be in touch and you can let them know whether or not you're interested. So that's a bit of a brief run through of the trial, but have you got any questions for me at the moment about it?
Yeah, how likely is it that my baby would get low blood sugars?
So that's a really good question, and actually for term babies we don't really know. We think that the background risk is about 10 to 20%, but we don't routinely test babies for low blood sugars. Those babies that we know are at higher risk, particularly those ones born before 37 weeks, ones that are particularly big or particularly small for their age, and we do routinely test blood sugars in those babies, and it's about 50% of those babies would have a low blood sugar. So one advantage of the trial, or some people have told me they think it's an advantage of the trial, is your baby will routinely get those blood sugar tests done, and we would treat your baby if it had a low blood sugar level.
Could this be dangerous for my baby?
Certainly untreated low blood sugar levels can be dangerous for babies, and that's why it's really important that all babies within the study have their sugars tested, and of course, as I've said, they'd be treated in the normal way. In terms of what may be the longer term effects of the steroids, it may be that they make things better, it may be that they make things worse, or it may be that there's no difference. But what the C STEROID team would really like to do is to extend the research, and so they will try and keep in contact with everyone who's involved in the study. And what they're hoping is that maybe in the future, once kids go off to school, they can make further assessments to see whether or not there's any long-term effects as well as short-term effects of the steroids. So thanks very much for listening. Just to summarise the C STEROID trial, the important bits of information that you need to impart to women when you first introduce it to them is that babies born by caesarean section before labour have a small but increased risk of short-term breathing problems. If we give steroid injections to mums before a premature birth, this helps to reduce the risk of those breathing problems, but we don't yet know if we see the same effect when given prior to caesarean section. And that's the purpose of the C STEROID trial, which is a randomised trial of steroid versus placebo injection for mums giving birth by planned caesarean section after 35 weeks. All babies within the trial will have blood sugar levels performed routinely for the first 12 hours, and any low blood sugar levels will be treated. We will then collect information from mother and baby's medical records. So we'd really encourage you to get your women to participate and join in, and thanks very much for your time.